Hello, my name is Dr. Drew V. Moffitt.
And today we're going to be talking about what is herd immunity and can we just rely on that? In previous videos in this series, we compared COVID-19 with the flu. We talked about the infection fatality rate, which deals with how deadly the virus is in terms of what percentage of all infected people die from that infection. For the flu, it is probably 0.06%. And for COVID-19, it is probably 0.05%. We also talked about how infectious the virus is, which is expressed as R naught, which is the number of people an infected person infects. For the flu, it is estimated to be 1.3. For COVID-19, the most recent estimate is 5.7. So, why is this important? Well, it turns out that this is central to answering the question, when will all this end? Or in other words, when will we achieve disease extinction? It turns out that it all has to do with the R naught, or the infectiousness of the virus. Disease extinction occurs when the total number of people immune to the virus reaches a certain percentage predicted by the formula 1 minus the quantity 1 divided by R naught. So, how big of a number are we talking about to achieve disease extinction? Well, again, the percentage of people that need to become immune to achieve disease extinction is predicted by the formula 1 minus the quantity 1 divided by R naught. The people can become immune by either herd immunity or vaccination. Herd immunity means immune from infection. Well, here lies the crux of the problem with COVID-19. With the flu, R naught predicts that 23% of the population needs to be immune, or 76 million people. For COVID-19, with its R naught of 5.7, a much larger R naught, the percentage is much larger, 82%, or a whopping 273 million people. Now, I've heard a lot of people ask the question, well, why don't we just rely on herd immunity now and not wait for a vaccine? Well, this can be answered by looking back at the number of people needed to achieve disease extinction. If you look for the flu, basically we need this 67 million people, right? Well, let's look back at this infection fatality rate that we calculated. That rate is low, as we decided. It's 0.062%. Well, when you have that infectious disease rate, but you multiply it by 76 million people, you get 47,359 deaths. Well, current CDC estimates that in this season we're going to have about 24,000 to 62,000 deaths. So that number is right in what they're predicting, right? Well, let's look what happens for COVID-19. With an R naught that's a lot higher, you get a lot higher percentage of the people that need to be immune before you get disease extinction, or this 273 million people. Well, when you multiply a low infection fatality rate of 0.05%, you're going to be multiplying that small number by a very, very big number, and that ends up meaning that you're going to have 136,466 deaths. Well, as of April the 19th, there were 40,265 deaths. So, with the high R naught giving us such a large population to achieve herd immunity, and that giving us predicting 136,466 deaths, and with us having currently 40,265 deaths, in order to achieve herd immunity, we're going to end up having another 96,201 more deaths. Well, that is simply not acceptable. It's just too many deaths. So what do? Well, if you want to watch other videos on this topic, it'll explain how we can achieve extinction of this virus without relying just on herd immunity. Well, I hope you enjoyed this video and found it informative. If you did, please share it with somebody, and be safe.